Welcome to Palliative Care Explained, a channel aimed at answering your questions about palliative care. My name is Dr. Jonathan Wong, and I'm a palliative care doctor based out of Winnipeg, Canada. In this video, I will provide you with important questions to ask that will help you gain a better understanding of your illness. Without the right information, making important decisions about your care and about your future will be much more difficult and stressful. So let's talk about it. Please see the introductory video of this channel for more information about me, my declaration that I do not have any conflicts of interest or financial sponsors, and for the medical legal disclaimer statement. I will put a link in the description box below. Even though I am speaking to you as a palliative care doctor, this approach can be applied to any patient with any diagnosis and at any stage of health. Here's the key point. The people best equipped to help you understand your illness is the medical team most familiar with your unique situation. That's the first and best place to start. So how do you get the most out of your medical team? In my opinion, a big part of that is knowing how to approach your medical team and knowing what to ask. When your medical team comes to meet with you, it often feels like time rushes by much more quickly. It may feel like your medical team is asking you 100 questions or talking really fast. There may also be a feeling that there's a power imbalance between you and your medical team. And this is where it all falls apart. Patients are often afraid to say, "Stop, rewind. What was that last part?" As patients do not want to be seen as being difficult or uneducated. Often, patients feel like they are wasting the medical team's time. Trust me on this one. You are important, and you are not wasting their time. It's okay to say, "Can you please slow down?" Or "Can you please say that again?" This happens to everybody. Myself, I see several specialists due to my own underlying medical illnesses. And let me tell you, this happens to me, and I'm a doctor. All too often, after a clinic visit with my specialists, my wife will ask me, "Hey, did you remember to ask about this or that?" And I will sheepishly say, I must have forgotten to. So believe me when I tell you, this happens to everybody. My suggestion is to have a trusted friend or a family member accompany you to the clinical visit. Having someone else there may help put you more at ease and may make you feel less intimidated. Furthermore, more sets of ears are always better. Your friend or family member can also take notes for you, allowing you to better focus on what is being said. If your friend or family member is unable to attend in person, here's what I would suggest. Ask your medical team for permission to have them participate over speakerphone or through the app of your choice. In my clinical practice, I encourage this all the time in order to get more people involved. Your medical team has a duty to ensure that you fully understand what is going on. You are the most important person in the room. If there are words or concepts that you do not understand, do not hesitate to ask for clarification. This is the time to ask. Now, with respect to understanding your illness, I do not think you need to have an in-depth knowledge of anatomy and physiology. But I do think you need to have a good sense of what is happening inside your body and why things are happening. I encourage you to prepare beforehand. Write some questions down on a notebook, or make some notes on your device, and then ask your medical team these questions. Which body part or organ is affected by this illness? What does this organ normally do? How well is it still working? What does this mean for me and my function, both now and in the future? Will these changes improve with time, or will it get worse? What sort of timeline are we talking about? Having clear answers to these questions will help you understand what your illness is doing to your body, as well as seeing the bigger picture of living with the illness. In palliative care, we focus heavily on a patient's symptoms or how they feel. I encourage you to openly tell your medical team about any of the symptoms you may be experiencing. Further, you can ask these questions. Why am I feeling this way? Is this related to my illness or something else? How will this change with time? Recognizing the cause and effect relationship between your body and your symptoms is another very important part of better understanding your illness. The next step is to understand the available treatment options, what the intentions are, and what the expected outcomes are, and not just the best case scenario. If a specific treatment plan is offered to you, I encourage you to ask these questions. What will this treatment actually do? And how will it solve the underlying problem? Is this a temporary fix, or will it be a long-term solution? Furthermore, I encourage you to ask, what is involved with this treatment, and what are the risks? Is this the only treatment option? What are the alternatives? From a palliative care perspective, here's another very important set of questions. Will this treatment actually make me feel better? And if yes, how so? And by how much? How will it improve or change my function? How will it impact my lifestyle or my daily routines? Openly discussing the pros and cons of any treatment option and how it might change how you feel is essential to gaining a better understanding of your illness. The next few questions are going to be tough ones, and perhaps not asked enough by patients. How will this treatment affect the course of my illness? Will it give me more time and allow me to live longer? Will it give me the energy to enjoy the time I have left? If this treatment doesn't work, is there a next step or something else to try? What would happen if I chose not to undergo this treatment? These are definitely tough questions to ask and potentially difficult answers to receive. In medicine, there are scenarios where the decision-making is much clearer. In those cases, the treatments are clearly advantageous and the benefits far outweigh the risks. But in the setting of a serious or life-threatening illness, things are much more complex and less clear-cut. There are many other factors that need to be considered, many of which are specific to that particular patient. These scenarios require a more nuanced conversation that is tailored to that particular patient's situation. And that is why the medical team most familiar with your situation is the best team to answer your questions. They know you and what's happening in your life. Thank you very much for watching this video. I hope it will be useful in helping you gain a better understanding of your illness.